Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Androgen insensitivity syndrome. True is androgen insensitivity syndrome. Phenotypically, they are females. No, they are actually males. No, phenotypically, yes. Androgen insensitivity syndrome. Okay. Androgen insensitivity syndrome. True is in androgen insensitivity syndrome, phenotype of the baby is female. True. Whereas genotype of the baby is male. They are 46XY. They are predominantly ovarian component in gonads. No, there will be testicular component in gonads. Okay, testes are always females. Actually, their genotype is male. Testes formed abnormal and receptors are normal. Receptors are abnormal. Okay, so this is the correct statement. Next.
thank you and thank you for watching.